Welcome to today's webinar on strategic planning for immunization supply chains. Thank you for joining us. It looks like we have a little bit more than 50 people attendees for this webinar, and given that the registration was over 200, I suspect we'll have a few more people joining us as we go along. My name is Barbara Lamphere. My colleague Greg Roche and I are presenting this webinar today, and we'll be co-facilitating all the webinars in the Immunization Supply Chain Leadership webinar series. From time to time, we will also have guest panelists joining us for the webinar series.
Just a bit of background on us. Barbara and I have worked for many years building the capacity of individuals and organizations to manage and improve health supply chains. We have worked extensively in Africa, Asia, and the Middle East across a variety of health programs, and we're pleased to be working with you as immunization program and supply chain managers to expand your leadership skills in supply chain management.
In today's webinar, we will discuss strategic planning for immunization supply chains. This is the first webinar in the series that will cover a range of topics meant to build your supply chain leadership knowledge and skills. The topics in this series include use of data for performance management, managing your team, the relationship between supply chain and reaching your coverage targets, integration of vaccines with other health commodities, and cold chain management. These topics were chosen by many of you who completed the needs assessment questionnaire in July. Many thanks for your input into that questionnaire and to help define what our series would cover. We will have one webinar each month except for the month of January, and we'll be sending you registration information prior to each webinar. While all participants are on mute during the webinar presentation, we invite you to ask questions using the Q&A function in Zoom. We will answer as many questions as time allows at the end of the webinar. We will also be using your questions to help fuel future online discussions on these topics, and we'll be sending you more information about that online discussion forum. To increase our interaction, we will also ask you to participate in a few polls during the webinar itself.
In addition to the webinar, we invite you to complement your learning through a gaming application hosted on the Health Games website, where you can test your knowledge and understanding of the content of each webinar and compete against other participants for the highest score. A prize will be awarded to the participant with the highest score after the webinar series is completed. You will find the link to the gaming app here and in the follow-up email you receive after this and every webinar in the series. And on a final note, those of you who attend 4 out of the 5 webinars will receive a certificate of participation. Each webinar is recorded, so if you can't participate in the live webinar, you still have the opportunity to refresh your knowledge of the content and get credit for participating. Let's move on to the webinar topic for today, strategic planning for immunization supply chains.
Here are the objectives for today's webinar. After we discuss a few basics, we will look at examples of how country programs have developed immunization and health supply chain strategies, and what those strategies have included. We will also look at how different stakeholders and partners are involved in the strategic planning process. To get us to start thinking about the purpose and objectives of an immunization supply chain strategic plan, I'm going to ask you to take a poll. So I'm going to pull down the poll, and I would like you to answer these questions. You can do so. And I'll give you about 30 seconds to answer these questions. So I hope everybody is seeing the questions. A few people have started. Good.
Yep, just click on the answers that you choose.
Give you a little bit more time. We may be able to get everybody to answer, so far. More than half of you have answered. Feel free to finish up answering. Okay, I'm going to end the poll now, and let's look at the results. All right. As we can see, more than half of you have actually been participated in the development of the supply chain strategic plan. That's great. The majority of you, for the purpose of that strategic plan, was to plan activities, followed up by funding needs, and of course, building consensus around priorities. And obviously, those things also influence supply chain strategy and supply chain policy. What was the objective of the majority of your strategic plans? The objective really was to, majority of you said, improve supply chain performance and to improve product availability, which hopefully go hand in hand. Some of you actually said to integrate multiple supply chains, and we will talk a little bit about integration of multiple supply chains in this particular webinar as some examples of our country examples. But we will focus, I think it's our the fifth webinar in our series that will actually, we will address that topic directly about integration of multiple supply chains, and including immunization program supply chains within health supply chains. So thank you for participating in the poll, and let's move on with our presentation and discussion.
Strong supply chains are essential to effective and efficient immunization delivery. To have a strong supply chain, a country or a program needs to have a comprehensive immunization supply chain strategic plan to guide efforts to improve supply chain performance. Without such a plan, efforts to ensure vaccine availability or strengthen the supply chain may flounder, and valuable resources may be wasted on one-off or ineffective efforts that don't take into consideration the supply chain as a system. In order to garner funding and partner support for supply chain improvement, a solid, well-constructed immunization strategic plan should be developed, implemented, monitored, and updated. WHO, UNICEF, Bill and Melinda Gates Foundation, and Gavi have developed a big picture immunization supply chain strategy that helps us begin to think about how we might frame a country immunization supply chain strategic plan. The Gavi strategy includes 5 fundamental elements, many of which are discussed as part of this webinar series. Supply chain leadership. Immunization supply chains require dedicated and competent managers as well as skilled personnel at all levels of the health system. This is the overall goal of this webinar series, to build leadership capacity among immunization supply chain managers. The third webinar in our series focuses on the supply chain team and empowering personnel to do the job. When developing a supply chain strategic plan, it is important to consider the leadership, the team, the people that are needed to manage the supply chain, and the competencies that are needed.
The second fundamental in the Gavi immunization supply chain strategy is continuous improvement and planning. Supply chains are evolving and dynamic systems that need to change to meet the needs of and changes in the health system and adapt as resources and inputs change. The performance of the supply chain should be continuously monitored, managed, and improved. In the second webinar in this series, we will look at indicators, and tools, and discuss how to use supply chain data to manage supply chain health immunization supply chain performance. The third of the fundamentals of the Gavi immunization supply chain strategy. The strategic plan needs to include how data are managed and used to ensure optimal supply chain performance and how managers can plan for and facilitate continuous system improvement. The fourth fundamental of the Gavi immunization supply chain strategy is cold chain equipment. As you all know, vaccines require reliable, well-maintained, and cost-effective systems of cold chain equipment. When developing an immunization supply chain strategic plan, cold chain management and maintenance is an essential component of that plan. The last of the fundamentals in the Gavi immunization supply chain strategy is supply chain system design. A supply chain is a system, a network of structures and relationships that work together to achieve the goal of product availability. To ensure that a supply chain is functioning in the most efficient and effective manner, we need to look at the overall design of the system and find opportunities to improve it. A supply chain strategic plan may include interventions to strengthen operational functions and optimize use of resources. We will see a number of cases where strategic plans include efforts to integrate specific supply chain functions with other health commodity supply chains, or merge data collection and management systems to improve efficiency. So let's get down to what a supply chain strategic plan itself includes. A supply chain strategic plan is critically important to public health supply chain management because it provides guiding principles and interventions along with corresponding implementation activities to address the systemic challenges and goals that have been identified. While a strategy is helpful at any point, it's particularly useful when countries are addressing system challenges or are ready to introduce new approaches or resources to address supply chain issues. Supply chain strategies are developed for defined periods of time, often 5 to 10 years, but should have specific points when they are assessed and refreshed to address new circumstances, challenges, and technologies. This allows stakeholders to define a set of objectives and activities they would like to accomplish over a defined time period, track progress, and continue to visualize the future state. So those of you who said that you were involved in the development of supply chain strategies previously probably did supply chain strategies for a very specific period of time, whether it was a 5-year strategy or a 10-year strategy. A supply chain strategy helps to define a set of objectives, activities required to optimize the supply chain over time, and can uncover challenges or threats as well as approaches to overcome them. One of the important aspects of developing a supply chain strategy or strategic plan is that the process of developing that strategy helps to align stakeholder objectives around what is that vision for the supply chain? What is it that we want that future state of the supply chain to look like? And it gets everybody on the same page as to what that vision is. A supply chain strategic plan also helps ensure coordination of activities implemented by multiple partners and helps avoid duplication of efforts and best leverages limited resources. Plus, the strategy helps define and clarify various stakeholder roles in the implementation of that strategy. These activities are critical to connecting the actors and organizations along the whole integrated end-to-end supply chain.
Let's look at an example of a recently developed immunization supply chain strategy developed by the Ethiopia Pharmaceuticals Supply Agency. After conducting an effective vaccine management assessment in 2013, EPSA identified a number of weaknesses in the immunization supply chain, including storage temperatures at central and regional levels, management throughout the system, and weaknesses in distribution between levels, while there were strengths in storage capacity, infrastructure, and equipment. That assessment led to the reinvigoration of the Vaccine Transition Plan in 2014, transferring the responsibility of vaccine management from the Federal Ministry of Health EPI program and the regional health bureaus to EPSA. This plan was in line with a policy decision to integrate all health supply chains within EPSA. As part of the transition, this immunization supply chain strategy was developed with the overall goal to strengthen supply chain management and to ensure the availability of quality vaccines and immunization supplies for effective program delivery. The process for developing the strategy was initiated in October 2017 and was finalized in April 2018 with a strategy finalization workshop. The strategic priorities for the strategy were identified through a participatory and iterative process with stakeholders from EPSA, Federal Ministry of Health EPI program, national and subnational levels, and partners involved in immunization supply chain, such as UNICEF, CHI, and JSI, to respond to weaknesses identified through the SWOT analysis conducted through stakeholder meetings starting in 2017. This 5-year strategy is centered on the 5 fundamentals of the Gavi immunization supply chain strategy that we saw previously, and includes initiatives under system design, cold chain management and maintenance, leadership and human resources, continuous improvement and planning, and data for management.
So let's look at some of the fundamental components of a supply chain strategy or strategic plan. A strategic plan outlines the strategic goal, priorities, and objectives. A strategic goal is a broad general statement of long-range purpose. This is supported by a set of strategic priorities, which are general statements of what needs to be done or in place to reach the strategic goal. And those are further supported by a set of strategic objectives, with each priority having its own set of objectives. These strategic objectives are statements of what will be achieved at the end of the time period covered by the strategic plan to address the priorities and meet the goal. You will note the hierarchical relationship of these components of the strategic plan, with the goal being the highest level. If you recall, the goal in the Ethiopia plan is to strengthen supply chain management and ensure the availability of quality vaccines and immunization supplies for effective program delivery. To get an idea of the level of detail for each of these aspects of the strategic plan, let's go back to the Ethiopia example and look at a sample of the priorities and initiatives they developed to get them to their goal. You will remember that the Ethiopia immunization supply chain strategic plan uses the 5 fundamentals as included in the Gavi strategic plan. So for the fundamental of system design, this is the Ethiopia strategic priority as set out in their strategic plan. So their system design strategic priority is to build a resilient, agile, and efficient supply chain that can ensure a reliable and predictable supply at all levels of the system to meet the demand of customers. Now that's fairly high level. So let's look at what it's going to take for them to achieve that strategic priority. To achieve the system design strategic priority, as written here, EPSA identified 4 objectives of what they have to accomplish to achieve that priority in system design. So we're dealing with the system design strategic priority, and there are a set of 4 objectives that they will work on or are working on at the moment to address that system design strategic priority. The first is to transform and strengthen the current processes in order to ensure efficient, effective, and sustainable inbound logistics, forecasting, and procurement. The second objective in system design is to assess and update the current storage and inventory management system to ensure adequate stock and vaccine potency. The third objective is to ensure efficient distribution of vaccines to service delivery points. And the fourth is to improve transportation and fleet management practices. So you'll see they're going to be dealing with 4 different areas in system design to reach that strategic priority of a reliable and predictable, to be able to ensure reliable and predictable supply at all levels in the system. Okay, let's drill down even more into this and see what actions they're taking to achieve this. Let's look at the first objective. So this first objective that relates to inbound logistics, forecasting, and procurement. And so their actions to achieve that objective are to increase vaccine and immunization supply security through a reliable procurement system, to ensure vaccine quality by timely customs clearance and reporting within 24 hours, and to increase accuracy of demand forecasts through data triangulation. So they're going to take these 3 efforts to improve their inbound logistics, forecasting, and procurement system. We will see, if we were to look at their strategic plan, that this is even broken down even further into their implementation plan, into sub-activities that each of these objectives. This same level of analysis and detail is included in the strategic plan for each of the priorities. In the case of Ethiopia, for each of the 5 fundamental areas that they cover, which are equivalent to those in the Gavi strategic plan, and includes objectives for each priorities and initiatives or actions for each objective.
Okay, to summarize, the strategic plan includes these components: goal, priorities, objectives, initiatives or actions, and performance indicators. While we didn't look specifically at the performance indicators for Ethiopia, their immunization supply chain strategic plan does include output indicators, such as % of storage facilities stocked according to plan, % of cold chain equipment and supporting equipment functioning, and closed vial wastage rate, as well as indicators to measure each of the strategic initiatives. The strategic plan may expand to include aspects of the implementation elements listed here, or the implementation plan may be a separate document. Now it's time for another poll. Let me see if I can get this to work. So I would like to ask, for any of you who have created a strategic plan, or if you've been involved in the development of a strategic plan, which of these components shown did you include in the plan? Goals, priorities, objectives, initiatives, actions, sub-actions, responsible parties, timeline, budget, indicators, outcomes. Please take a minute and please vote. Which of these did you include in your strategic plan? Take another 30 seconds. We have lots of votes coming in. Okay, just another 10 seconds. Okay, so thank you for voting. And if you haven't voted, maybe the others haven't participated in the strategic plan. It looks like the top element of your strategic plan is the objectives. Obviously, there's also the goal is right up there. and then timelines. So those are like the three top elements. So that's looking at the big picture and then getting into some of the details. We have some budgets, some indicators, some outcomes, priorities and actions and so forth. So thank you for that. And as you're going forward, as we're going forward, we want to try to, sorry about that, I'm still learning. Those are the results I hope you can see. And we want to try to make sure that as we go forward and further develop strategic plans or start to develop strategic plans, that we do want to pay attention to all of these elements. So thank you for that, and let's move forward.
So I suspect, I just want to comment on the poll. I suspect that there is a fine line distinction between with a strategic plan and the implementation plan. And in some cases I've seen where programs have included the implementation plan within their strategic plan, or maybe a separate document. So some of these elements, such as sub-actions and responsible parties and things, may actually have shown up in people's implementation plans, which may not have been included in the strategic plan. So sometimes it's a matter of the language we use and understanding what is the strategic plan versus what is the implementation plan. And I don't think that distinction necessarily needs to be made as long as that the actions are well defined and everybody knows where to find what needs to be done by whom, in what time frame, and with what budget, and so forth. Eventually, that helps support the strategic priorities. Okay, shall we move on? Let's close this poll out. All right. We have already alluded to some of the process of developing a strategic plan with the example from Ethiopia, but let's get into a little bit more detail. Defining the need for the strategic plan is the first step in the process. A rapid assessment provides the evidence base to understand the current capacity and performance. As we saw in the example of Ethiopia, they started with an EVM assessment, or an effective vaccine management assessment. That may be conducted and provide valuable input into the strategic plan. The EVM may also be helpful to establish the performance indicators that will be used by the performance management system to measure progress on the implementation of the strategy. Analysis of the assessment can then be used to drive the discussion about how the supply chain can support the overall immunization program goals or health goals in the short and long term. It's very important to take into consideration other emerging trends in the system, in the environment around the immunization supply chain, to help inform the strategic plan. Health policies or global initiatives that may be taken into consideration when developing your strategic plan. Things like universal health insurance, new health policies, the Gavi transitioning, and so forth. In order to ensure acceptance of the plan by senior MOH leadership and to get the support that's needed, it's very important also that the immunization supply chain strategic plan should be fully aligned with and support the larger national health strategy. And to know the health strategy well and to figure out where does it fit in, where does our immunization supply chain strategic plan fit in promoting the national health strategy, and to take into consideration the global, regional, or country immunization roadmap. Once stakeholders reach consensus on what the vision for the supply chain is, what the goal is, what are the needs that we need to address, what the priorities and approach are, a detailed implementation plan can be developed which defines those key activities, roles, timeframes, and resources required to implement the strategy.
Okay, this diagram shows the timeline of the development of the supply chain master plan in Liberia for a supply chain in which vaccines are integrated. A supply chain master plan is similar to a strategic plan, as it is the strategy along with the complementary operational plan. The timeline for strategy development varies significantly across countries. In this case, while discussions about developing a master plan took place over several years, from 2007 to 2010, the initial strategy development was about 2 months. The master plan was updated in 2015. For comparison, Ethiopia's strategic planning process took about 6 months after several years of activities which informed the plan. In Liberia, the process included a series of interviews, site visits, and a stakeholder workshop. A key first step in the process was the appointment of a supply chain manager within the Ministry of Health and Social Welfare, who anchored the strategic planning activities and was supported by a design team that drew from the program supply chain managers, county pharmacists, and other key stakeholders. This team played an active role during the master plan development. The process included an analysis of assessment information and preliminary design of the pipeline, roles and responsibilities, and functions that was presented to the Ministry of Health and Social Welfare for approval. Key stakeholders involved in the process included the Ministry, Global Fund and USAID, who were funding the plan development, CHAI, who facilitated much of the process, and SCMS and JSI, who provided technical support. After the strategy was developed, the Ministry of Health and Social Welfare hosted a working meeting to develop the implementation plan. Participants were tasked with translating the desired strategy into detailed activities to include in an implementation plan, including time frame, responsible party, and resources required. A detailed activity budget was developed to accompany the implementation plan. This working meeting was also a forum to address lingering issues that required resolution from the initial strategy development. For example, the expected scope of the procurement unit vis-a-vis the supply chain management unit. These decisions were subsequently incorporated into the final master plan document.
Let's look at some of the lessons learned in the process of developing Liberia's supply chain master plan to see what may be applied in other countries' strategic planning processes. So the first lesson is that the leadership, ownership, and participation of the Ministry of Health and Social Welfare were instrumental to the process.
During the planning phase, Ministry of Health and Social Welfare led the process to get consensus between the ministry and partners for a single vision and approach for master planning. Ministry officials also actively managed collaboration between key partners and oversaw the technical assistance teams. This involvement provided critical input and buy-in required to resolve many complex issues.
The second lesson learned was that defining the master planning process at the beginning was essential.
The master plan in Liberia was defined by two key components, a supply chain strategy and an implementation plan. Excuse me. Clarifying and documenting the master planning process provided a clear sense of the required outputs of master plan and focused participants who were inclined to start working on solutions to plan for them instead. In other words, during those discussions, they were trying to solve the problems rather than trying to plan for implementing solutions.
The third lesson is that representation of all supply chain functions on the design teams was critical. And when we say all supply chain functions, when you think about the logistics cycle and all the activities in a supply chain, as well as all the management functions, all those folks needed to be included on those design teams.
The master plan in Liberia addressed the entire supply chain. And that included all entities, organizations, functions, and product areas so it was critical to have subject matter expertise from a broad range of technical areas. The team was selected by the ministry from ministry staff. Technical assistance teams from SCMS and JSI were also carefully selected to fill gaps that existed in local capacity.
The fourth lesson learned is that master planning meetings provided a forum for broad buy-in on roles and responsibilities in the supply chain.
By the time the implementation plan meeting began, the master plan concept and process were known widely throughout the relevant ministries. Because the master plan development involved mapping out the roles of various partners, the process resulted in an immediate understanding of new or evolving roles and entities within the supply chain.
The fifth lesson was that the Global Fund proposal deadlines offered a time frame and format for master plan development and implementation.
The Global Fund Round 10 proposal presented an opportunity to request funding for master plan implementation. As such, the timing and format of the master plan was shaped by the requirements for proposal submission, and a costed implementation plan was fully developed as a detailed activity budget to fulfill a Global Fund proposal requirement. The activity budget has proven to be an effective resource mobilization tool for implementation, used to request support from partners other than the Global Fund. Liberia's process was not without its challenges, and lessons can be learned from these. The first challenge/lesson, reaching agreement on one approach for master planning across partners and stakeholders was time-consuming and resource-intensive.
Although there was a broad consensus on the need for a master plan, reaching an agreement on a unified approach and scope was difficult. It really came down to the ministry's leadership and CHI's support in negotiating, communicating with all the various partners during the planning process that ended up resulting in a process and scope that aligned with the ministry's vision. In hindsight, it may have been more helpful to convene meetings on a more regular basis to ensure consensus of all parties involved. And so while they had done some of that, they needed more to meet more often and to really work on the consensus building amongst all the parties to get through this beginning process of one approach for the master plan. Another thing is that they really needed to, and eventually did, assign a point person in charge of this communication within the ministry, but it took a while to get to having that person who was assigned and really working to help with this coordination within the ministry.
Another challenge they faced was the lag time between the development of the strategy and the implementation plan. It was a missed opportunity to resolve and gain consensus on outstanding issues.
So there was a delay of a few weeks between the finalization of the strategy and the beginning of the implementation plan development. This represented a time that could have been used to make a headway on getting additional stakeholder buy-in, but also to address unresolved issues that arose during the strategy development process. So it's very important to try to avoid any lag time between that strategy development and the implementation plan development.
Yet another challenge, they found that more targeted participation in the master planning, stakeholder, and synthesis meetings may have been helpful.
So while their master planning process was very participatory and engaged a broad range of stakeholders from multiple ministries and levels in the systems and partners, many, but not all of the stakeholders who were involved in the strategic planning meetings were able to participate in the implementation planning meeting and the development of the implementation plan. So they lost some of that overlap of stakeholders. Some of the continuity was lost between the strategic planning and the implementation planning. And this represented a challenge to ensuring that the integrity of those decisions that were made during the strategic plan, that was actually carried over into the implementation plan development.
Okay, a final challenge that we're going to look at is regarding the time delays that existed between gaining widespread agreement on the master plan itself and then actually having the funding for implementation.
While limited resources were available upon the launching of the master plan, accessing the resources required for full implementation is a longer-term process. It's important to set realistic expectations for the strategy amongst all stakeholders, especially for that first year. It would have been helpful in the Liberia situation to emphasize that implementation plan development involves estimating costs for subsequent resource mobilization rather than allocating existing funds. So while they may have had funds for the first year, the implementation planning and the strategic planning process helped identify the resources needed for subsequent years, but did not mean that you had to have that funding available then, but was useful for resource mobilization for future years of the implementation plan. To wrap up our webinar, let's identify what happens after the strategic planning process. As we saw in the Liberia example, it is extremely important to secure funding for the plan, or delays between planning and implementation can occur, and particularly obviously for that first year of the implementation plan. Engaging potential funders in the planning process may help to ensure their contributions to funding implementation of the plan. So involving those funders in those discussions of the strategic plan helps to secure that funding, obviously. And certainly efforts to secure funding can start earlier in the strategic planning process. Although critically important, strategy development is just the first step in the process. The strategy is a living document. It is used to guide the work of strengthening the supply chain. It needs to be regularly updated and revised to ensure that stakeholder objectives and roles and incentives are well aligned and that everyone is moving towards strengthening the supply chain system. On an annual basis, stakeholders can review progress, validate assumptions, set new priorities for the coming year. And certainly you want to be monitoring your indicators going along that measure the progress of the strategic plan, probably more frequently than annually. In addition, it's important to keep the momentum and motivation to achieve the goal of the strategic plan by supporting the owners and champions of the plan. And it's really important to be sure that a clear champion and ownership of this plan is known. Establishing routine reviews of the KPIs, the key performance indicators that measure progress towards the goal, can help keep stakeholders involved and focused on achieving the goal of continuous availability of quality vaccines. The strategic plan obviously should be implemented. The complementary implementation plan should be developed and used, and progress measured and celebrated as milestones are achieved towards reaching the immunization supply chain performance goals.
Okay, so this is the end of the webinar. To review, today we have described the purpose and key objectives of an immunization supply chain strategic plan. We've listed components and illustrative outcomes of an immunization supply chain strategic plan. And we described collaboration and partnership priorities for an immunization supply chain strategic plan. We do have time before the end of our hour to address some questions that have come in. I've been looking at some in the chat boxes, and we may have others. Should I go with the first question?
Sure.
Okay, so one of the questions, I'm not sure I got all the names, but I believe Mariam Zamir, welcome. You put as a question, is the strategic plan for immunization supply chains or multiple commodity groups? And I think the answer to that we've seen through the Liberia example. The Liberia example was for a fully integrated supply chain, so that would have covered their strategic plan, would have covered vaccines and immunization products along with all other health commodities. In Ethiopia, it was specific to the immunization supply chain. And in other countries that might have vertical systems for other program products, you would really want to have a supply chain strategy for each of those independent or vertical systems.
Okay, there's a new message. Let's see what the new message is. Is it easier to start with only one objective? Are multiple objectives achievable? So I think it takes multiple objectives to reach your goal. You know, supply chains, immunization supply chains are complex. As we saw with the Gavi 5 fundamentals, they suggest the 5 different areas, and under those areas there would be different objectives to improve the supply chain functioning in each of the areas. So we obviously could have cold chain objectives. We may have objectives related to the system design optimization of, say, fleet management or storage conditions and so forth. So there are going to be different objectives based on the different components that you're working on, so forth. We will be sharing, there was a question here, and certainly we will be sharing the PowerPoint. We will actually be sharing the whole recording of this webinar with you, as well as additional resources, and we'll get into that in a few moments. One question was, can the contents of the plan be modified within the time chain frame in accordance with emerging needs? Greg, do you want to answer that one?
Sure. I think we touched upon that on a couple of the different slides, but certainly you would want to be monitoring the performance of your supply chain as you're implementing changes. You would want to monitor the actual implementation of your strategic plan. So for example, if you've scheduled a certain number of activities during the 6 months, during a 6-month period, you want to be monitoring and make sure that those activities are being implemented according to your plan. But then of course, we also have to think about maybe a new technology comes along, or maybe you identify a challenge in what you're implementing. You certainly want to be doing a review of your supply chain performance and your implementation. And you do want to be making adjustments as you go along to take into account, for example, an unforeseen circumstance, maybe an emergency situation, or some other development that could help you even better improve the implementation of your supply chain or your master plan. So yes, to summarize, certainly you can make modifications along the way. You want to be always moving towards the same goal, but you can make small changes or some kind of changes in the implementation, I think.
There was a question about the Liberia supply chain master plan. It is, whether it was a 10-year plan. It's actually a 5-year plan and will be probably updated fairly soon. We will be sharing additional information about each of these case studies so that you can have more information on them. And I noticed a comment from Hanok, who I'm hoping will be a guest panelist for one of our webinars later on, maybe the one on integration of immunization supply chain within the larger health supply chain. He says that they've been, from Ethiopia, they annexed their implementation plan with their costs to their strategic plan. So it's not within this, it is an annex to their strategic plan in Ethiopia, but it's certainly an important part. And as we saw with the master planning in Liberia, master plan is essentially a strategic plan and an implementation plan or operational plan combined. Great. Any other questions we see?
I see 2 in the Q&A. Okay. The first one, can there be true consensus when developing a strategy? I've seen pressure points in discussions that drag on for too long. How best can partners reach consensus? My response to that would be that that we need to have clear direction from the ministry. We need clear direction from the EPI program, whoever is involved in overseeing the products or the programs that are being affected by that strategic plan. I think everybody has to be given a chance to provide their input. And I think in the end, the ministry has to decide. So everyone provides their input, but the real consensus is everybody has to agree that once the ministry, this is my opinion, once the ministry makes their final decision, to try to support that as much as possible. So it might not be true that everybody gets all of their opinions implemented or all of their ideas implemented, but I think it means that everybody in the end has to support the implementation of what was finally decided. That's my opinion.
Let's see, I'm looking down.
There's another in the chat. There's a question.
Okay, go ahead. Go ahead. Sorry.
About how can supply chain performance be monitored. This is actually the topic of our next webinar next month, and we will give you some information about that shortly.
Okay. All right. Try and see if there are any more questions. Thank you for your compliments and for wanting more information. I think Greg is going to wrap up our discussion today with some information about how we're going to move forward after this discussion. I think there was a question from Philippe about in Liberia, what were the main reasons for causing delays in getting everybody together in the same basket. I like that analogy. I think that a lot of it has to do with the answer that Greg mentioned before in getting consensus. You know, people the different players, different partners come together with different priorities. But actually everybody usually comes together with the same ultimate objective and ensuring that we have continuous supplies of quality vaccines and so forth, but people come from different perspectives and different priorities. And so, you know, it's the same idea of building consensus. There's a question, how do we cope with managing the logistics of clearing immunization commodities from customs and resource constraint settings due to constant delay from the customs? I'm going to put that on our parking lot list because that's a very specific thing related to customs clearance. That's from Edward in Nigeria. And Edward, we will, we're hoping what we're going to be doing after this webinar and after future webinars is holding some online discussions. So I'm going to put that on our parking lot for a possible online discussion, and let me do a little bit more research and giving you some resources about clearing of immunization commodities through customs. We can't really get into all those details today. We're coming towards the end, and I'd like to let Greg finish up. Thank you for all your questions. And as I said earlier, we will be using the questions that we didn't get to help fuel some more online discussions. And we will see that probably through IAPHL or through maybe other forum that we will start using to continue this conversation after each of the webinars. So Greg, I'm going to turn it back to you to give the final wrap up on what's going to happen after this. Thanks.
Okay, great. Thanks very much, Barbara. So again, thanks to everyone. So we're just a couple of reminders following this webinar. Everyone will be receiving a follow-up email very soon after we conclude. The email will include a list of references and resources on today's topic. You'll get 2 case study briefs that give some more details about the Ethiopia and the Liberia examples that we were talking about during the webinar. And we'll also give you some suggestions for further reading. The email will also include a link to the webinar recording and, most importantly, a link to the gaming application where you can review the content of today's webinar and compete for the highest score. At the conclusion of this webinar, you will be directed to an evaluation form that you can use to provide us feedback to help us improve webinars in the future. And we will really appreciate your input. I also want to mention, I think I made a mistake at the beginning. We have 6 webinars in the series, not 5. and you will get a certificate of participation for participating in 5 of those 6. We hope that you'll be able to participate in our next webinar, as I just mentioned. It will be in October, on Tuesday, October 15th at 1300 GMT, Greenwich Mean Time, and the topic will be Managing Health Supply Chain Performance. You'll get a registration link to that webinar, also by email, within the next week. Again, thank you for joining us, and we hope to see you again on a future webinar.